You already love your dog, but love isn't always enough. Your pet can't tell you when something's wrong. Let me ask you something that I think about a lot. What if the thing you do to help your dog when they're in pain is making things worse? Not because you're a bad owner, not because you don't care, but because nobody ever told you that some of the most instinctive, natural, well meaning things dog owners do in these moments are the exact things veterinarians say you should never do. I'm talking about things like going straight to the medicine cabinet, pushing your dog to walk it off, scolding them for behaving differently. These feel like the right moves, and that's exactly what makes them so dangerous. Because the road to a dog suffering longer, or suffering worse, is almost always paved with good intentions. Today, I'm giving you the list that could protect your dog from that road. 7 things you should never do if your dog is in pain, and what to do instead. And stay until the end, because mistake is one I need every dog owner to hear before it's too late. If you're new here, welcome to Pet Help. My name is Elizabeth, and this channel exists because your pet cannot tell you when something is wrong, and you deserve someone in your corner who can help you understand what they're trying to say. On Pet Help, we cover real pet health topics clearly, honestly, and without the complicated medical language that leaves most people more confused than when they started. We post every Monday, Wednesday, and Friday. If that sounds like something your dog deserves, hit subscribe right now and tap the bell icon so you never miss a video. And if you watch the video on the 10 hidden signs your dog is secretly in pain, this video is the direct follow-up. Everything we cover today connects directly to what we talked about last time. If you haven't seen it yet, I'll link it at the end of today's video. It's worth going back to. Now, let's get into today's topic. So here's the reality. Last week, we talked about recognizing the signs that your dog is in pain. This week, we're talking about what happens after you recognize them. Because here's the truth most people don't realize. The moment you suspect your dog is in pain is also the moment you're most likely to make a mistake. Not because you're panicking, but because the instinct to help, right now fast, without waiting, can lead good dog owners to make decisions that hurt the very animal they're trying to protect. So, let's walk through all 7, starting with the one that surprises people the most. Before we get into the list, I want to give you one piece of context that makes everything else make sense. When your dog is in pain, your brain does something very specific. It looks for the fastest solution available. And the fastest solutions available are almost always the human ones. The things you do for yourself or for a family member if they were hurting. Grab a painkiller, rub the sore spot, keep them moving so they don't stiffen up, reassure them until they settle down. These feel right because they are right for humans. But here's what the American Animal Hospital Association says clearly in their official pain management guidelines. Never overstep your role by administering pain medications meant for people or another pet. There can be life-threatening consequences. Source: your dog's body processes pain and the substances we use to treat pain in fundamentally different ways than a human body does. And the same instincts that make you a compassionate owner can also, if misdirected, make things significantly worse. So with that foundation, let's go through all 7. Mistake: giving your dog human pain medication. Never give your dog human pain medication. This is the number 1 mistake, and it is the one that sends dogs to emergency veterinary clinics every single day. Let me paint a picture for you. Your dog is limping. It's 9 o'clock at night. The vet is closed. Your dog is clearly uncomfortable, and all you want to do is help. You think, I'll just give them half an ibuprofen. That's what I'd take for pain. Surely it won't hurt. Please, if you take nothing else from this entire video, take this. Ibuprofen, acetaminophen, aspirin, and naproxen are toxic to dogs. Not mildly harmful, not okay in small doses. Toxic. Cornell University veterinary specialists treated a dog that arrived in their emergency clinic comatose and trembling, with constricted pupils, after ingesting ibuprofen pills that had been left on a countertop. The dog needed intensive emergency treatment and spent 4 days in their ICU. According to emergency veterinary specialists, toxic effects from human pain medication can begin in a dog within just 1 to 2 hours of ingestion. Here is exactly what these medications can do to your dog's body. Medication. What happens in your dog's body? Ibuprofen, Advil, gastric ulcers, kidney failure, liver damage, neurological effects. Acetaminophen, Tylenol. Destroying red blood cells causes liver failure, even infant doses can be fatal. Aspirin, stomach bleeding, ulcers can worsen internal pain and bleeding. Naproxen, Aleve, one of the most toxic NSAIDs for dogs. Kidney and GI damage begin rapidly. Dr. Lauren Forsyth, pharmacy head at the University of Illinois Veterinary Teaching Hospital, states clearly, human pain medications are much more likely to cause toxicity in animals than they are in people, which is why there are veterinary-specific medications that are less toxic. What to do instead? Call your vet, even after hours. Most veterinary practices have an emergency line or after-hours answering service. You can also call the ASPCA Animal Poison Control Center at 888-426-4435. They are available 24 hours a day. There are safe, vet-approved pain options specifically designed for dogs. Ask for those. Mistake: giving your dog medication prescribed to another pet. Never use another pet's prescription for a different pet. This is the one that surprises people most, because it feels so logical. You think, it's the same medication. It's for dogs. Fido used it last year and it helped him. My new dog has the same problem. Why wouldn't it work? Here's why it's dangerous. Every prescription a veterinarian writes is personalized to that specific animal at that specific moment in time. Your vet considers the exact body weight of your dog, dosing is precise, any current medications your dog is taking, interaction risks, your dog's individual health history, kidney or liver function, existing conditions, the specific source of the pain. What works for one type of pain can be wrong for another. Pet Wellbeing's veterinary advisors put it this way: vets must consider many factors when prescribing medication. One medication might not be appropriate for all pets. It's crucial for your pet to have their own prescription. And the AHA pain management guidelines go even further. Never administer pain medications meant for another pet. There can be life-threatening consequences. A dose that helped your healthy 70-pound Labrador could cause organ failure in your smaller or older dog with different health needs. What to do instead? Every time, every pet, new evaluation, new prescription. This is not overcaution. This is the standard that protects your dog's life. Mistake: forcing exercise or physical activity on a dog in pain. Here's a belief that is deeply embedded in pet owner culture. Movement is good. Get them moving. Walk it off. They'll feel better. And this instinct comes from a true place. Movement is beneficial for many dogs in certain contexts. But here's what happens when you force exercise on a dog who is actively in pain. You override their body's protective mechanism. When a dog refuses to walk, pulls back from stairs, or won't jump, that reluctance is not stubbornness. That is their body saying, if I move like this, I will make this worse. According to VCA Animal Hospitals, exercise restriction for dogs in pain is specifically designed to decrease forces placed on injured areas during movement, allowing inflammation to subside. And in cases involving spinal pain or orthopedic injury, inappropriate movement can accelerate disease progression. Think about it this way. If a person has a stress fracture in their foot, you don't tell them to walk it off. You tell them to rest. Your dog is doing the same self-triage. Honor it. What to do instead? If your dog is reluctant to move, let them rest and call your vet. Describe exactly what movements they're avoiding. That information is diagnostic gold for your veterinarian. Do not try to push through discomfort on your dog's behalf. Mistake: massaging or applying pressure to the painful area without guidance. Massaging incorrectly can make pain significantly worse. I want to be clear about something before we get into this one. Canine massage therapy, done correctly by a trained professional for the right conditions, can be genuinely beneficial for dogs in pain. A 2021 study of 527 dogs with chronic musculoskeletal pain found that owners reported significant reduction in pain levels after a series of properly administered massages. That's real, that's important. But here's the flip side, and it matters enormously. Done incorrectly, massage can make infections, cancers, recent injuries, blood clots, and inflammatory disorders significantly worse. PetMD, reviewing the medical literature, states clearly, done incorrectly, massages could make some infections, cancers, recent injuries, blood clots, or inflammatory disorders worse rather than better. The Merck Veterinary Manual adds that excessive pressure from massage has the potential to injure organs, vessels, neural tissue, and bone. And the most common scenario? An owner sees their dog limping or guarding a body part and starts rubbing the area they think is sore, deeply, firmly, without knowing whether there's a fracture, an infection, a tumor, a blood clot. Your instinct to soothe your dog with your hands is beautiful. It comes from love. But that same loving touch, applied to the wrong condition, can cause real harm. What to do instead? Gentle, light stroking along your dog's back, away from the area that appears painful, is generally safe and comforting while you wait for a vet appointment. Deep pressure massage on or near a painful area should only happen under veterinary guidance. We're halfway through, and I want to check in with you for a second. Of the 4 mistakes we've covered so far, how many of them have you done? Because I'll tell you, almost every dog owner I speak to has done at least one, usually more. And that's okay. You didn't know, and now you do. That's exactly why this channel exists. Drop a comment below and tell me, which of these surprised you most? I read every single one, and I'll be replying today. And if this video is helping you become a better advocate for your dog, please hit the like button right now. It genuinely helps other dog owners find this information when they need it most. Let's keep going, because the next 3 mistakes are the ones that quietly cause the most long-term harm. Mistake: punishing your dog for pain-related behavior. Never punish pain-related snapping, growling, or withdrawal. I need you to sit with this one for a moment, because this is the mistake that breaks my heart most when I hear about it. Your normally gentle, sweet dog suddenly snaps at you when you try to pet them. They growl when you pick them up. They hide under the bed and refuse to come out. And your response, completely understandably, might be frustrating, or hurt, or a sharp no, or a raised voice, or a correction. But here's what veterinary behavioral experts want every dog owner to understand. That snap, that growl, that withdrawal, that is your dog saying, "I hurt, and I'm scared that you're going to make it worse." According to IMRI's Med veterinary pain researchers, pain-related aggression isn't a behavioral issue in your dog. It's a cry for help that needs to be responded to with compassion and medical support. And the research is definitive on what punishment does in this situation. It doesn't address the pain. It doesn't change the behavior. It adds fear and anxiety on top of the physical suffering your dog is already dealing with, making the whole situation dramatically worse. Think about what happens when a human is in pain and someone scolds them for flinching. The pain doesn't get better. The relationship damages, and the person learns that showing pain leads to punishment, so they hide it even more. Your dog does the exact same thing. What to do instead? When your dog shows pain-related aggression, the IMPRI-Med protocol is clear. Do not punish it. It worsens fear, anxiety, and aggression. Move calmly and predictably. Approach from the front. Let your dog see your hands. Minimize touching the painful area until it's been assessed by a vet. Create a quiet, safe space. Soft bedding, away from other animals and children. Call your vet and describe the behavioral changes. This is diagnostic information they need. Mistake: assuming pain will resolve on its own, and waiting. This is the quietest mistake on this list, and it is the one that causes the most damage over time. Not because of anything dramatic, just because of time passing. Here's the internal monologue most dog owners have. They're probably fine. Let's give it a day. It's been 2 days, maybe another day. They seem the same, maybe one more week. And 3 weeks later, they're at the vet. And the vet is saying that a condition which was very manageable a few weeks ago has now progressed to a point where treatment is significantly more complex and expensive. According to West Park Animal Hospital, untreated pain can cause other severe medical conditions to occur. For example, an NMS Pet Emergencies veterinary team states, waiting to get your pet the care they need prolongs their suffering, which can lead to shock, dehydration, and other serious complications. Here's the other thing that wait and see does, and it connects directly to last week's video. The longer you wait, the more your dog's brain adapts to the pain. Chronic pain that persists beyond the initial injury changes the nervous system. The body's pain signals become more sensitive over time, not less. An area that hurt a little eventually starts to hurt more, and more intensely. The American Animal Hospital Association is explicit on this point. Recording pain is now considered the fourth vital sign alongside temperature, pulse, and respiration. Because early intervention always leads to better outcomes. What to do instead? If your dog has shown signs of pain, any of the signs from last week's video, or any sign that concerns you, for more than 48 hours without a clear explanation, that is your signal to call your veterinarian. Not tomorrow. Today, a phone call costs nothing. The peace of mind it provides is everything. Mistake. Ignoring the emotional and psychological dimension of your dog's pain. Pain doesn't just hurt the body, it changes the mind. And we've arrived at the final mistake. And this is the one I promised you at the beginning. This is the one I think about most, and the one I believe matters beyond all the others. Here's what most people understand about a dog in pain. It hurts. Physically, here's what most people don't understand. Pain doesn't just hurt the body, it changes the mind. The AHA Pain Management Guidelines state something important and underappreciated. Pain can cause a pet to lash out because fear and anxiety can amplify pain. Pain makes dogs anxious. Anxious dogs experience more pain. More pain creates more anxiety. And that cycle, once it takes hold, is extremely hard to break. And here's what happens in the homes of well-meaning owners while that cycle is being built. The dog becomes withdrawn. The owner, unsure how to handle it, gives them space. The dog becomes more isolated. The isolation amplifies the anxiety. The anxiety amplifies the pain. And slowly, over days, over weeks, the dog that once greeted you at the door becomes a shadow of themselves. Not because the original injury was untreatable, but because no one addressed the emotional dimension of what they were going through. ImpriMed's veterinary researchers confirm this pattern. Even with the pain addressed, your dog may retain anxiety or some of the defensive behaviors they developed while managing their pain on their own. So the final mistake, the one I most want you to take from today's video, is this. Don't just treat the body, see the whole dog. When your dog is in pain, they need medical treatment, addressed by your veterinarian. Physical comfort, soft bedding, easy access to food and water, minimal stares, emotional presence, your calm, consistent, reassuring presence, freedom from punishment for any behavior that comes from their pain. Environmental support, a quiet, low-stimulation space to rest and recover. The AA says it perfectly. Pain management is a team effort. At home, you are the eyes and ears of your veterinarian, and you're always the voice for your pet. You are your dog's entire world, and when they are hurting, you are the single most powerful factor in how they experience that pain. That's not pressure, that's a gift. Use it well. I want to put everything we've covered today in perspective with some numbers. Ibuprofen and acetaminophen toxicity in dogs are among the most frequently reported poisoning cases at animal poison control centers. And the ASPCA's Animal Poison Control Center receives calls about human pain medication in pets every single day. According to Cornell University veterinary specialists, the cases they see most frequently involve owners who genuinely believed they were helping their dog, not realizing the medication they chose was actively destroying their dog's kidneys or liver from the inside. And the AHA-AAFP Joint Pain Management Guidelines, the gold standard document for veterinary pain treatment, emphasize that pain is now recognized as the fourth vital sign in animals, and that early, educated intervention is the single most powerful predictor of a positive outcome. Every mistake on today's list has one thing in common. It delays or disrupts the moment your dog gets real, appropriate professional help. And every day of delay in most pain conditions means more suffering, more progression, and harder recovery. You know what those mistakes are, and you know how to avoid them. I want to say something before we wrap up, something that I think a lot of dog owners need to hear. If you've recognized yourself in any of the 7 mistakes we talked about today, if you've given your dog an ibuprofen, or waited too long, or scolded them for a snap that came from pain, or rubbed an area that was hurting without realizing you might be making it worse, please let go of the guilt. You did those things because you love your dog. You reached for what you knew. You acted on instinct. You tried. That is not failure. That is what love looks like before knowledge catches up to it. And here's the truth that I want you to carry forward. Everything on today's list has a better alternative. There is always something you can do. Something safe. Something that helps. Call your vet. Offer water. Create a quiet space. Sit beside your dog calmly. Keep a pain behavior log. Tell your vet exactly what you've observed. These things, simple, quiet, gentle things, are profoundly powerful when a dog is in pain. Because at the end of the day, what your dog needs most isn't a pill from your cabinet. It's you, informed, present, advocating for them, and you just became a little better at that. Let's quickly recap the 7 things you should never do if your dog is in pain. Mistake. Give your dog human pain medication. Ibuprofen, Tylenol, aspirin, or naproxen are all toxic to dogs. Mistake. Use pain medication prescribed to a different pet. Dosing and conditions are never interchangeable. Mistake. Force exercise or push your dog to walk it off. Their reluctance to move is protective. Mistake. Apply deep pressure massage to a painful area without veterinary guidance. It can worsen fractures, infections, tumors, and clots. Mistake. Punish pain-related behavior. Snapping, growling, and withdrawal are cries for help, not bad behavior. Mistake. Assume pain will resolve on its own and wait. Delayed care leads to progression, complications, and harder recovery. Mistake. Ignore the emotional and psychological dimension. Pain changes your dog's mind, not just their body, and they need your presence as much as your action. And the single most important thing to remember from everything we covered today, when your dog is in pain, you are not helpless. You just have to know which actions help and which ones hurt. Now you know both. If this video helped you, I want to ask you to do 3 things right now. Subscribe to Pet Help so you never miss a video that could protect your dog's health. New videos every Monday, Wednesday, and Friday. Like this video. It takes 2 seconds, and it tells YouTube to show this to other dog owners who need it. Share it. Text this video to one dog owner you know right now. You might be sharing it at exactly the right moment for them. And if you have a question about your dog, about their pain, about something you're unsure about any of the mistakes we covered today, leave it in the comments below. I read every single one. And one more thing. If you haven't watched the video on the 10 hidden signs your dog is secretly in pain, the link is right here on screen. These 2 videos are designed to go together. Watch that one next. Remember, your pet can't tell you when something's wrong, but with the right knowledge, you can learn to listen in other ways, and you can learn to respond in the right ways too. Until next time, take care of yourself and take care of your pets.